So good morning, everyone. I am Jessie Whittish with Kentucky Youth Advocates. It's great to see all of you, either for the first time or for the umpteenth time, for our Advocate Virtual Forum. This is our last forum of 2020. And just a reminder that we are going to be recording today's forum to share as both a video and a podcast. So we just ask that you stay muted during the forum, but we are going to have a short data presentation and then a panel discussion. So we encourage you to drop questions into the chat if you have them. Many of you asked really great questions when you RSVP'd. We've tried to incorporate those, but if you don't see an answer to those or hear that, please feel free to drop that into the chat. Also, we're going to be discussing a new issue brief that was released today, and I'll drop a link to that in the chat as well, and we'll include that in the follow-up email. So with that, I will turn it over to Terry Brooks.
Hey, good morning. This is our 37th Wednesday forum. Pretty amazing, and we're so happy to have all of you here. As Jessie said, whether you're regular or first time. Jessie always asks me not to go overboard in talking about individuals, so I will not mention that I'm especially glad, Jane Emke, to see you. If you don't know Jane, she is a great champion around justice issues, and we're really happy to have her. So unlike, obviously, many of you, I've got the spirit, okay? Can you see that shirt, okay? Because I'm putting myself in good shape for Santa. Obviously, some of you aren't. But, you know, from the classic Peanuts movie, I'm incorporating that, Lucy asked Charlie Brown, "Are you afraid of responsibility? If you are, you have hygieneographia." Charlie Brown says, "I don't think that's quite it." "Well, how about cats? If you're afraid of cats, you have allurophagia." "Well, sort of, but I'm not sure." "Are you afraid of staircases? If you are, then you have climophobia." Maybe you have fossilophobia, that's the fear of the ocean, or geprophobia, which is the fear of crossing bridges. Or maybe you have phantophobia. Do you think you have phantophobia? Well, what's phantophobia? That's the fear of everything. That's it, Charlie Brown says. Well, you know, this is such... it's so easy, isn't it, to feel afraid of everything right now? And frankly, sometimes the response to feeling afraid of everything is you just give up. You know, and you have heard through all 37 forums that our operational hypothesis is just the reverse. There is never been a more important time for your voices to be heard in Frankfort, because so many of the clients you serve justifiably are afraid of everything right now. And beginning today, we're going to start really focusing on Frankfort in 2021. One thing you're going to get from us, and I'm not sure how we're going to do it. Jessie, I'm sure, will let me know, but we're trying to figure out the best way to maintain this in January, in the middle of the session. If you have ideas, we'd love to hear from you, whether we keep this every Wednesday going, whether it becomes a half an hour. My hunch is that as we continue to do these during the general session, we will not be quite as precise in what that topic is going to be, because literally Tuesday night, something may happen and we need your voice on it Wednesday. So if you have notions about how we can best maintain the momentum of these, please let us hear. But today we'll give you a preview. In our conversation with President Stivers just last week, one of the areas he laid out that he thought was fertile for progress was around justice reform. And one of the things we brought up was that Kentucky has the third highest percentage in the nation of parents who are incarcerated. I don't have to tell you what that means. At a kid level, the trauma that little boys and little girls experience when mom or dad are imprisoned, the trauma imposed upon their families is profound. I was in a conversation Monday night on a news show, and the topic was the economy. We brought that up then because think about Kentucky with the third lowest workforce participation in the nation. Do you know how many potential workers who shouldn't be locked up are locked up? So when we talk about parental incarceration, it is absolutely a quality of life issue for kids. But guess what? It's also an economic development issue. And you know, and I know that the more we integrate different arenas, the economy and kids, man, that's a message that hunts in Frankfurt. So we have a great panel. You're going to hear two really smart KYAers, I might mention, kick this off. And then we have a number of partners, including my good friend and colleague, Jennifer Hancock from VOA, joining us to move this issue to what's the real landscape. And in my head, the really important thing is what do we need to be doing in Frankfurt in 2021 to do that? So I gave you that pantophobia, the fear of everything, but let's not forget the best line in that Charlie Brown movie is a simple recitation of that Christmas story that ends with Linus saying, "Fear not." And that's our wish for you as we enter this special holiday season. Fear not, and understand that Kentucky's kids have to have your emboldened voices as this new year begins. So Courtney Downs, I believe you are taking it from there. Thanks for joining us, and have the best of the holiday seasons.
All right, thank you, Terry. Today I want to let you all know that we are releasing a blueprint issue brief on maternal incarceration, and it'll be available on our website. We'll make sure that we include a link in the follow-up email as well. So we wanted to start today by highlighting some of the data that's shared in the issue brief, and then also do a quick overview of some of the recommendations. And then as Terry said, we have a really great panel today. You guys will learn more about a program that works directly with this population, and most importantly, probably just in my opinion, but we will be hearing from two amazing women who were at one point right at that intersection of parenting, substance use disorder, and incarceration. So to get us started with the data presentation, I am going to turn it over to Tara Grisham-Goodwin.
Thank you, Courtney. And Jesse's going to pull up a slideshow to get us kicked off here. And we have it rolling. Jesse, I think it might need to be put into presenter view. There we go. Thank you. So as Courtney said, today we are releasing an issue brief on data trends and also policy recommendations to address the impact of maternal incarceration on Kentucky's children. And for many years now, you all may have heard this a few times if you've been involved with the blueprint work, that Kentucky has had one of the highest rates in the nation of children who have had the experience of having a parent incarcerated at some point. The most recent data has us ranked third highest in the country. And here in our state, more than 1 out of every 10 kids has experienced parental incarceration at some point in their life. For the issue brief today, we gathered data from the Kentucky Department of Corrections and also received data from the Vera Institute of Justice to take a deeper look at parental incarceration in terms of what it looks like by gender, by race and ethnicity, by county. For the first time, we're able to look at it by county, and then also looking at trends in the numbers. And the data provide one piece of information to help us understand the challenges and identify solutions. And as Courtney mentioned, we have a couple of women who are going to share their experience as well, and that provides other very important context. When we look at the data, what we see in Kentucky, we looked at data for December 2019, and that is the most recent data actually that we were able to get. what we found was that if more than half of all people who are in state custody in Kentucky, and that includes folks who are in local jails or housed in state prisons who are in state custody, more than half of them were parents, 56%. And when you look at it broken out by gender, we see that for women who are incarcerated, 64% are mothers. For men, it's 55% are parents. So the latest data that we had was prior to COVID, and since then, some people who are near the end of their sentence or had significant medical issues have been released to try and prevent the spread. We are going to look at that data moving forward to see if any changes were specific with their impact on parents, but as you can see, with such a high percentage of those incarcerated being parents, we're not really sure if we'll see any major changes specific to parents compared to the overall population. So when we look just at that point in time of December 2019, the children that were impacted by parental incarceration at that point would more than fill an arena if we weren't in a pandemic. And if UK wasn't struggling so much right now in the season so far, we would have enough kids to fill Rupp Arena, and there would be another 8,500 children outside that wouldn't fit in. And so we know that we have, Jennifer, I see your comment. There may have been some discussion about UK and Notre Dame the other day, or earlier before we began. What we know is that there are a number of kids across the state who are impacted by parental incarceration. When we look at it by county, we see that in every county across the state, at least 1 out of every 3 people in state custody have children. And in some of these counties that have the orange, that are colored orange or teal, more than half of people in state custody have children. So it is an issue that impacts people across the state. Moving on to the next slide, we looked at the data factoring in the rate of, the population of the county. So we looked at rates of parental incarceration based on how large the counties are. And what we did was we grouped them using information from the National Center for Health Statistics based on how rural or urban the counties were. And a pattern really emerges here. You can see that rates of parental incarceration have increased over the past couple of years in all types of counties, but they've increased most in the rural and also in the small to mid-sized metro counties. As you can also see by the orange bars that represent 2019, rates are highest in rural counties for parental incarceration. One of the important trends that we have noticed, and this has been a point of discussion in recent years, but we thought it was important to look at it more closely with the numbers, was the increase that we've seen in the number of women who are incarcerated. We've seen steady growth in this, unfortunately, over several decades. So for jails, we had 83 women incarcerated in jails in 1970. We're up to 4,231 in the most recent data that we had, but you can see that trajectory of growth, unfortunately. And when you look at growth for both jails and prisons, Kentucky outpaces the nation's growth. Going back to looking at the rates in terms of the population sizes in the counties, we see pretty clearly that there's quite a gap in the rate of incarceration of women. And as we know, there's a high percentage of women who are parents. And it's even more distinct here between rural counties and Jefferson County, which is the most urban county in our state. In fact, in rural counties, the rate is more than twice what it is in Jefferson County. One of the pieces that we looked at specifically was impact by race, and we know that communities of color have historically experienced discriminatory policies in criminal justice, which have had a specific and profound impact on Black men especially. Some of the current policies and practices continue to perpetuate disparities. We know that there's a higher likelihood of arrest for drug crimes for Black people than for white people who use drugs at a similar rate. We also see more intense policing in some neighborhoods. What you see here for Black men is that in the blue, they show up in the blue with male population, and Black men make up about 8% of our state population, but they make up about 23% of people incarcerated. And that translates and impacts the percent of Black men who are parents who are incarcerated. They make up about 24% of male parents incarcerated. Where people are incarcerated matters. And so this slide shows people who are incarcerated in local jails. And while we weren't able to get full data on local jails that show the percentage of people who are parents, just a side note that jails operate individually, and so they do report some data to the state, but not in the level of detail that we would like to be able to look at parental incarceration as thoroughly as we would hope to do. But jails typically mean people can be closer to family, which is a positive and could make visitation easier. But right now during COVID, visitation hasn't really been an option across the state in jails or prisons. On the other hand, and I should say that even if people might be closer physically if they're housed in a local jail, that doesn't always mean that visitation options are easy for children. We know that there have been many efforts to improve the visitation for kids here in Jefferson County, for example, and in other places across the state, but that is a huge opportunity that is addressed to some degree in the issue brief. And while jails might mean people are closer to family, they often don't have the same rehabilitation and treatment options that state prisons tend to have. Again, jails operate individually, and so there's a lot of variation across the state. But of all people incarcerated in county jails, 45% of women are in state custody, and 47% of men are in state custody, which means they could be in a prison with access to substance abuse treatment, but are in the local jail, which may mean they don't have any access there in the facility. So one of the primary ways to limit parental incarceration is to think about who we are incarcerating in the first place. Thinking about who we are incarcerating versus who we can require other types of accountability from. For more than 1 out of 4 women who are in state custody, a drug offense is their most serious offense. And this may even underestimate the percentage of women who have a drug offense as their primary underlying issue. Many other women have property offenses or other things that are related to an underlying substance use issue. And for these women, community-based substance use treatment, and especially ones that support a family and in that process, would offer a better long-term solution, not only for addressing the crime, but also in terms of outcomes for the family and what the potential is for that family in the future. Women in state custody also have a high percentage of charges that are the lowest class of felony, so Class D felony, that are nonviolent and non-sexual. So for women, over half who are in state custody have had a nonviolent, non-sexual offense as their most serious offense. And these are cases where a person likely does not pose a public safety risk, and if they're also likely to return to court, using those community-based sanctions would reduce the impact for children. The report also includes information on who is released from jail and who is held after being booked. And while we weren't able to get this data by parental status, just knowing the high percentage of people incarcerated who are parents, it provides some an informative look. In the dark blue, you see that 58% of people overall remained in custody at the end of the day. And 25% of people overall remained in custody at the end of the day because of a financial reason, like inability to pay bail. This really takes us back to that point of using incarceration very judiciously and reserving it for those who pose a risk. For people who don't pose a risk but can't afford bail, we're talking about pretty substantial impacts on children and negative consequences for the family just as a result of not being able to pay. So those are some of the highlights of the data that are available in the issue brief, and I'm going to turn it back over to Courtney now to share report recommendations and then lead us in the discussion.
All right, thank you, Tara, for all of that information. So there are 5 recommendations that we made, and I'm going to go through those really quickly. So the first one, supporting the relationship or healthy relationships between children and incarcerated parents. So for that, we're thinking family-friendly, kid-friendly visitation policies. I mean, those are really key to fostering that emotional connection and allowing the parents and the child to have actual physical contact with one another as opposed to speaking behind glass or over video. And then also providing resources, or if there are groups that are available for people while they're incarcerated that can help to strengthen or maintain that parent-child relationship during that period, has been shown to reduce recidivism, and it ultimately benefits the child and the community that they're returning home to. The next one is to use community-based treatment. So if a program is available and the parent doesn't pose a risk to public safety, or they're not deemed a flight risk, they should be given that opportunity to treat their addiction in a community-based setting instead of in a correctional facility. This would allow for them to gain or to maintain employment, to stay in their children's lives, and then to be very well connected within their communities. The next one is factor in the custodial parent status when deciding on release whenever public safety isn't an issue. And we got this from Tennessee. There was a law that in Tennessee that passed recently that says that sentencing decisions should consider community-based alternatives for any nonviolent offenses when a person is a minor child's primary caregiver. And then focus incarceration on those who pose a risk to public safety. So with COVID-19, that really highlighted the importance of removing people from incarceration. So, we saw people who were getting sick. There were some people who were even dying just from being in close quarters. So Kentucky took some really important steps towards releasing people. And what we've seen is that they were able to do that without compromising public safety at all so far. And then finally, as Tara was just talking about, minimizing those financial barriers upon release so parents can support their children. When you have those fines and fees, those court costs, even child support, like those payments don't stop. They continue to accrue while you're incarcerated. And it puts parents in a position of having to choose between covering their basic costs, like paying rent or buying food, or potentially going back to jail because they missed a payment. So we need to take steps to modify these expectations, and whether that's through payment plans or delayed due dates, to allow the parents to get a couple of paychecks under their belt. Ultimately, it increases the likelihood of parents making those timely and consistent payments upon their release. So I know that was a lot of information in a very short amount of time, but you can read the rest of the issue brief in full today. And I also wanted to flag for everyone that parental incarceration, including some of the recommendations that we discussed here today, is on the blueprint, and there may already be a related bill in the works, so stay tuned for that. And now we can move on to our panel. And I want to introduce our panelists. So we are joined today by Jennifer Hancock, who is the president of Volunteers of America Mid-States, Shally Downs, who is a graduate of Freedom House in Louisville, and then we also have Brittany Edwards, who is a graduate of the Freedom House in Clay County. Brittany, are you on too? I don't know if I've seen her. Okay, well, we'll go ahead and proceed with Jennifer and Shally. So thank you both for joining us today. Jennifer, I want to start with you. For those who maybe aren't familiar with the Freedom House, can you talk a little bit about that, and then maybe more broadly about how Volunteers of America serves people, especially parents who have been incarcerated?
Sure. Thanks, Courtney, and good morning, everyone. I'm excited to be with you today and introduce you to my friend Shally, and hopefully Brittany will be able to join us shortly. But I do want to share a little bit about Volunteers of America's Freedom House program. I actually started my career, my social work career, back in the mid-90s at the other program in Kentucky that is similar to our Freedom House program. It's called Chrysalis House, and it's in Lexington. Go Cats, Terry Brooks. And that program was my first introduction to working with women and their children who had been affected by substance use disorder. My gosh, I fell in love with that population and would still be working at Chrysalia's house today, I'm convinced, if I didn't want to return back to Louisville, my hometown. So when I had a chance to come to VOA 14 years ago and knew that family-focused treatment was a key service that we provide here, I was so excited to get to return to my clinical roots of something that I love so much. And frankly, the reason that I fell in love with this model is because it is a 2-for-1 proposition, in that not only are we helping mothers reunite with their kids, have healthy babies, get clean and sober and on a path to recovery, we are truly disrupting this intergenerational cycle by treating kids in a primary prevention program. So they're getting to understand what addiction means, develop a framework of understanding so that they can verbalize their thoughts and feelings associated with it and really begin to heal from the trauma that they've experienced. And that's exactly what our Freedom House program is all about, is allowing the family to stay together. So we become an antidote for an overburdened child welfare system. In fact, we're eager to work with Commissioner Straub to go even more upstream, to integrate with DCBS in such a way that instead of getting referrals after the fact, after a removal, and then working to try to reunite this family after there's been that traumatic fracture of their family unit. Instead, I'd rather be working in tandem with the Department of Community-Based Services to provide assessment and be able to immediately refer families into treatment so that we can avoid the removal process and treat families together. We've been operating Freedom House at Volunteers of America since 1993. We had just about 8 to 10 beds for a very long time, until about 6 years ago, when the opioid crisis really exploded in the nation and in Kentucky and affected more women of childbearing age who simply could not stop using despite their best intent, because of how physically addicting opioids are. So they needed a professional solution. And so we had to very quickly expand our capacity. So we tripled our capacity in Jefferson County. We can now serve 45 families at a time here in Louisville. And then we're so proud to work with President Stivers, with Terry and the team at KYA, with many other partners that enabled us to open the first rural family-focused treatment program in Kentucky, in Manchester. We opened literally the first week of this pandemic descending on our nation and in Kentucky, and made a deliberate decision to push forward despite some risks of trying to open during a pandemic. And today we are full with a waiting list. We have 14 women and 5 children, so 19 people living in this sweet house in Burning Springs, Kentucky. And we have a waiting list. And in fact, I was in a meeting just a couple of days ago trying to problem solve for how we get these families into treatment during this holiday season, and how many of them might be willing to relocate to Louisville for a period of time, which is a big ask for people who may not have experienced the big city of Louisville, and Louisville might sound scary and be too far away from family for the holiday season. So we're trying to figure out how we make sure that we're caring for people during this time where we know overdosing is up. We know the mental health crisis is real as it relates to some of the consequences associated with the pandemic. So our team is working fast and furiously to make sure that we're expanding our capacity in Burning Springs. We've actually bought a house next door to our Freedom House program there in Manchester, and are working really hard to get it renovated and ready to accept more families there. So this comprehensive program is intended to be long-term. That's why we don't have beds available every day, because it's not a quick fix. It is definitely a crock pot type of program where we want families to sit and be still. We want them to dig deep and understand what is at the core of the substance use disorder. So we do a lot of trauma-focused treatments, and we make sure that we're working to address all of the long-term needs and building out an ecosystem that is recovery friendly. So housing and workforce reentry services, and for some families, getting them connected to medication assisted treatments. Certainly dealing with all of the postpartum issues that go along with parenting and being new in recovery, and reestablishing healthy bonds with family and natural supports. So that can take quite a while. Our program is intended to support women through their pregnancy and beyond, if not in treatment, at least in our aftercare program. And we are offering recovery housing here in Jefferson County. And soon we'll be opening recovery housing in Manchester too. So I'll stop there, Courtney, and see if you want me to dig deeper on any part of our program, or if you want to get started with the discussion with Charlie.
Yeah, no, I mean, I think the information that you shared is so important. And it's like I kept coming up with questions and you were answering them before I could get them out too. But yeah, and I think there will probably be opportunities as we go through it for you to share more, because I think it's so important. And I love that you're, you know, that the program is so comprehensive, and that you're also trying to expand, and that there isn't this time limit on it as well, which is, it's also important. So thank you for sharing as much of that information as you did. And yeah, I do want to bring in Charlie, and I apologize because I said your name wrong at the start. So, you know, at KYA, one of the things that we really prioritize is data, right? Like, it is so important. Obviously, it informs a lot of what we do. But what we also know is that it is equally important for us to prioritize listening to people, and especially the people who have been directly impacted and whose lived experiences make up that data. So I just wanted to give you a few minutes here just to share as much or as little as you're comfortable with about your story, and the experiences that led to you being in the Freedom House program, and then, you know, where you and your family are today.
I was trying to get my camera on.
You're fine.
My name's Charlie, and first I would like to apologize for unmuting my mic in the middle of Miss Jennifer's speech, and I try to hurry up and mute it again. But again, I have my oldest two sons here. I have a 15-year-old son, I have a 12-year-old son, and I also have a 6-year-old son who busted in my room while I was trying to listen to Miss Jennifer, so I apologize. But yeah, a little bit about my story. I washed up in the 7 counties detox facility back in October the 15th. Prior to that, I had completed the Centerstone program, went to the ARC and did a 60-day stay there, then went to St. Jude and relapsed. So I came back to Centerstone, detoxed fully. Then I'm also a participant in Family Recovery Court, and my Family Recovery Court advocates came up to 7 counties and asked me if I would like to join the VOA program. And at that point, I was willing to do whatever I had to do at that point. So I listened to my advocates and went ahead and went to the VOA program, and I did do a 60-day stay at the one on 2nd Street. They really helped me dig down deep to figure out what was wrong with me, because in the beginning I just thought, you know, that I had a drug problem. But there I learned that I had a disease that I was going to live with pretty much for the rest of my life. And also, the VOA moved me into the apartments that they have over there on Shelby Street. And what that did was that provided me a way to work my program, and also to incorporate my children within my program. And that I did not really have before. Like I said, when I went to the ARC, we had visitations, but the kids could never stay there. It was like a hour-long visitation once a week on a Sunday. Excuse me. Yeah, it was like an hour-long visitation at the Ark on Sunday. But like I said, when I worked the program at the VOA, it was different. It incorporated my kids, and I believe that is another thing that helped me really succeed in my recovery, because like you said, deep down inside, those core issues, with me, my core issue was that I became a bad mother, and I've always wanted to be the best mother that I could ever be. And again, VOA helped me do that. The only thing that I really can suggest about the VOA is actually incorporating more family-friendly activities, because for most of these women, pregnant and parenting women, our core issue is getting down on ourselves for what we've done in the past, from using drugs, is beating ourselves up as a mother to the children that we have or are going to bring into the world. So, that's a little bit of my story. I've also, I didn't mention this, while I was working the program early at the VOA, I had gotten picked up on a warrant, and I had not, I hadn't done anything, but a car that I was in just happened to be stopped, and I found out that I had a warrant out, Clark County in Jeffersonville, Indiana, for an old possession charge that I thought I had cleared up, but I had not. It was that I didn't go back to that the last court date to finalize my probation that I agreed to. So early on, while I was at the Freedom House, I got picked up, like I said, and eventually I had to go down to LMDC, and I did about 5 days there, and then they extradited me to Jeffersonville, and I did maybe 4 days there. And the whole time I was locked up or incarcerated, women were doing drugs all around me and offering me drugs and everything. And the whole time I just couldn't think about anything else but to run back to the Freedom House. And because I felt like that's where I was making my progress at. That's where my safety was at. That's where my future was at. So like I said, long story short, my brother picked me up. My brother picked me up in Jeffersonville at maybe like 10:30 at night. And my brother was like, "What do you want to do? You need anything?" I said, "No, I just want to go right back to the VOA." And that's exactly what I did. And I'm so glad that I did that, because I wouldn't be where I am today. I'm sober. My sobriety date's 10/16/19, and I have all the thanks and gratitude to give to the VOA and its program. So I really would like to thank you, Ms. Jennifer, for all the work that you have done, everything that you have created. It's working because I'm living proof. I can't speak for anything else. I'm living proof that that program works. And in AA, we're taught that in order for us to keep what we have, we must give it away. And that's what she's doing. Even though she's not a part of AA, but she learned that something worked and she's giving it away. And that's what I would like to do. I've learned that this program works in all its aspects, and all I want to do is give it away and help somebody. So that's pretty much all I have to say today.
Well, thank you, Charlie. I don't know if you can see the comments, but everybody is just saying how proud of you they are. And congratulations. And that's what I wanted to say as well. Congratulations on all of the hard work that you've put in. And thank you also, just for helping to humanize this issue for us. If you're okay with maybe answering like one or two other questions, we'd love to keep hearing from you. And when you talked about, being locked up for, like 9 days, it sounded like maybe 8 or 9 days altogether. One of the policy recommendations that we made early on was talking about, having more like family friendly and kid friendly environments. Can you like talk at all about like what visitation was like, or just, and again, just as much as you're comfortable with, you don't have to go into a lot of detail, but just, what that looks like, and then what could be improved upon, like within those jails.
Yeah, as are you? Can you repeat that again? Are you talking about incarcerated?
Yeah, like while you're, yeah, in jail. So like in jail, what was visitation specific? What was that like? And then what are some things that maybe could have been done differently to make it more family friendly or more kid friendly, if anything?
Um, I would say I mean, I really wasn't incarcerated for that long.
Mhm.
So if you're speaking about me having visitation while I was incarcerated, I never got that opportunity
Okay.
because I believe I didn't stay there that long to even have that brung up as an issue. If that's what you're looking for.
Yeah. Okay. Yeah, no, that's fine. Um, Jennifer, can we, I kind of want to back up a little bit. And, you know, you were talking about kind of moving upstream, working a lot closer with DCBS. And we know that a couple of years ago, the Dignity Bill passed. And I know that that had a big impact on women being able to access your program. For those who aren't familiar, can you maybe talk about that and how you know, that also acted as like a preventative measure for women?
Yeah, great segue because I was actually on a Zoom this morning with the state chamber, and they were doing a panel on criminal justice reform and substance use disorder, and Senator Rocky Adams was talking about her dignity bill, and we worked closely with her on this. She made the comment this morning that I thought was so poignant. She said, "Our prisons were not built for women, and they were certainly not built for parenting women or women who are pregnant." And I'm just so grateful that she took this on a couple of years ago and said, enough is enough. We are not going to allow women to leave in handcuffs to go deliver their babies. That is inhumane. It's inappropriate, particularly for women who are waiting on treatment. They need to be treated prior to delivery. And so since the passage of Senate Bill 133, we have received many referrals from jail. In fact, when that bill passed, by the end of that first month of July, when it first went into, when it was first started in July, I guess, would that have been July of 18? We immediately saw an uptick in referrals from jails across Kentucky. There was such a big demand. In fact, it became a little complicated for us programmatically because we had women who had spent many months in jail, even in a couple of cases in rural jails, had spent over a year, and came to us not quite ready for treatment. Not, you know, they had developed some coping skills to keep themselves safe in jail. And you heard Charlie talk about all of the risks of being incarcerated, the exposure to substances, the exposure to violence, and really having to behave in a certain way to protect yourself and keep yourself safe. So we had all these different women coming from all these different jails across Kentucky. And now we're asking them to be in a therapeutic environment and see each other as their sisters in recovery and not as a threat. And that was tough for our staff to really start to shape and mold a therapeutic community that was pro-recovery, pro-sisterhood. And we learned a lot through that experience. But that dignity bill was absolutely critically important to giving women a pathway out of incarceration. And we actually are continuing to work with Senator Adams on Dignity 2, which is something that she wants to work on as well. And I think you've been a part of those discussions.
Great, thank you. And kind of keeping, maybe moving over a little bit, talking about the courts. I know that like family recovery courts have been something, Charlie, you just talked about as well. So maybe kind of circling back to you, and Jennifer, you can jump in as well with any information that you have for folks maybe who don't know about it. But can you just talk a little bit more, Charlie, about your experience with the family recovery courts?
Sure. Family recovery court, like, oh my goodness, they gave me my foundation, my very solid foundation. Family recovery court is, well, I'll just tell you what happened to me. So, CPS got involved. Thank God they did. And so in my time of youth, I was thinking about how can I slip through the cracks and keep my kids without having to go through all that. And I went up to do a urine test. I tried to alter it, and that did not work. And I just was like to myself, I said, I'm tired. I'm so tired of running. At that point, I was just beat down. And I had to report to court, in fact, to Miss Judge McDonald's courtroom. And I was given an option through my public defender that there's this program called Family Recovery Court. Hold on, Brayden. Hold on. Thank you. So there was this program called Family Recovery Court, and it was voluntary. It was a voluntary program, but my public defender Weber explained to me what it was. In my mind, I was like, this is going to be something that's going to hurt me. This is going to be something that's going to put a whole lot of time in between me getting my children back. And just thank God that I put those thoughts out of my head, and I signed up for this Family Recovery Court. And boy, am I glad I did, because they have it structured to where you do urine tests, but they also are not against MAT. So they're for MAT. They do urine tests, but they give you a chance. Like, you would think going in that the same judge that was going to take away your children would be the same judge that was going to be, crack down on you if you mess up. But no, while I was there, I seen quite a few women come back with positive drug screens, and the judge was stern, but the judge she spoke out of love and concern. And that really put it into my head that, maybe this program will work. Maybe if I give her a chance, or give myself a chance rather, and put in some work, I'll get some results. And boy, when I started small, they have this program to where you do 4 milestones. The last milestone is putting the family back together. They have you going to the dentist. They have you picking a primary care provider. And like I said, it feels like it just gave me a foundation to move on to the VOA, and that's what happened. But really, I would advocate for Family Recovery Court just as much as I would advocate for the VOA, because I worked those two programs together, and I've successfully completed the VOA, and I'm getting ready to successfully complete Family Recovery Court. And I feel like one could really go with the other, really.
Yeah.
I just think that's such a beautiful testimony to the power of these programs working together. One of the things that I love about Family Recovery Court, and Charlie articulated it perfectly, that it is high touch, high accountability, high support and love. And,
Yeah.
and we don't always see all those things working together. That's our approach to treatment. We treat out of love with high accountability. And we see that in Family Recovery Court. We also share a philosophy that we call harm reduction. Instead of having this abstinence only, you're either on the wagon or off. And that kind of proposition that oversimplifies the disease of addiction, it almost forces people to start behaving dishonestly, right? It incentivizes being dishonest because it becomes fearful to acknowledge that I'm starting to experience some relapse behaviors. So we say we want to take the next incremental step towards abstinence, but we're not going to discharge you or punish you for being honest and letting us know that you're struggling. In fact, that's where we want to swoop in and offer more supports. So I am really excited that we'll be launching the second Family Recovery Court in tandem, just as you heard Charlie articulate it. These two programs should be hand in hand. Well, we're going to now get to do that in Manchester, and after the first of the year, start the second Family Recovery Court and take all the lessons learned from Charlie and the other participants and apply those to this Clay County program, and see what kind of positive outcomes we can produce.
Great. Thank you. And last question for each of you, even though I feel like we could go for like another hour just listening to both of you talk about all of this because it's just fantastic. What is one thing that you want the advocates on this forum to remember or to take action on, just based on your experiences that you've shared with us today, the knowledge that you each have? What are the takeaways?
I would say, just like Miss Jennifer just mentioned, that I have the experience seeing both sides. If a woman comes in and messes up, which that's what we do, that's what should be expected. I feel like she said, if she comes in and she messes up and she shows that she's still trying, or she's showing signs that she really does want to be a part of the program, but it's just really hard and difficult for her, I feel like the approach would be to find out why it's really difficult for her. And that could be many reasons. And those are what I feel like needs the attention, not just, having this expectation that, since she wants it, she should be doing this or she should be doing that. Everyone is different. All of our walks and all of our approaches and all of our success come from different standpoints. And it's not going to just take just one or two programs or one or two approaches. It's going to take like a trial and error approach. So I would say, if you see the signs that she's trying and she wants it and she's not going to give up, that's the woman or the mother that really needs the most help.
I love it. I hope that we can share a photograph of, I guess, my final point, and I want to share a story. It has to do, and I guess the takeaway I hope you'll leave today's call with is that even those who are experiencing severe and chronic substance use disorder, who have histories that you think, how can they ever overcome this? Because it's been year after year, relapse after relapse. What I know is that recovery is possible for everyone. And I have learned to never count anyone out, because miracles happen every day. And sometimes things click in the most unusual times that is completely unpredictable. So on the screen are two of my closest friends, Megan and Amy. Megan and Amy met in 2011, so almost 10 years ago. And they shared something in common. They shared several things in common, one of which was they were each kicked out of their home counties by judges who were tired of seeing them repeatedly show up in courtrooms. Amy on the right was kicked out of her town in Virginia. And so she left and came to Kentucky. And Megan on the left was kicked out of Rowan County by a judge who said, "I'm tired of dealing with you, get out and go." So they found their way to Louisville. And on a day in 2011, Amy was graduating Freedom House. Now, Amy began her journey, and she's very open about this. She says that she went into delivery and she was living in an abandoned apartment that had no running water and electricity. And she went into labor. She had been using throughout her pregnancy, and she injected heroin one last time because she could not imagine going to the hospital and going through withdrawal at the same time she was going through delivery. So she goes to the hospital. She has her son who was very ill, and someone came into her hospital room after delivery and told her about Freedom House. That's how she began her recovery journey with us. She stayed with us, began college, started as a social work student in the bachelor's program. Fast forward, she just completed her master's degree in social work at the Kent School in May of this year. She is a dear friend of mine. I love her dearly. Her husband works for us at VOA. He's in recovery too. And then Megan, on the day Amy's graduating, is the admission that day. So it's her very first day in the big city of Louisville. She said she'd never been to Louisville, Kentucky before. She was scared to death. She's a small town country girl. And Amy recognized the fearfulness in her eyes and reached out to Megan and said, "Look, if I can do this program, you can do this program." And that began an unbreakable bond. To this day, they are best friends. They talk every day. I get to be in a group chat with them where they crack me up. They have the sweetest relationship. And I'm telling you the story because tonight, Amy and Megan are catering a meal for 45 women at our Freedom House programs here in Louisville. They wanted to have a gratitude dinner to pay forward to the women at Freedom House and to say, look at us. We have all of this sobriety under our belts. Amy has a master's degree. Megan is now the vice president of program development for addiction recovery care back in her hometown. And they are doing beautifully. So long-term recovery is possible for everyone. And I share Amy and Megan's story today, and I'm sharing it in an editorial to the Courier Journal because it has inspired me so much this holiday season to see them giving back to the current residents of Freedom House. And like Charlie, everyone has a gift to pay forward, and she's now getting to pay forward her gifts as part of being a sober mom in recovery and part of an AA community, and now part of our VOA family as my newest colleague.
Perfectly, beautifully said, Jennifer. Thank you. And Charlie, again, thank you so much for joining and sharing, and congratulations on all of your hard work as well. I am now going to turn it over to Terry again for a minute.
Hey, thank you so much, Charlie and Jennifer. Also, Courtney and Tara, we really appreciate that. So I don't want to in any way sound like Scrooge, but I'm going to, and here's the reason. All of us feel inspired. I mean, if you can't hear today's forum and feel inspired, something's wrong, right? Don't leave it there. Don't leave it there. You remember last week, President Stivers said that he looked for one thing in common for people who he really listened to. He listens to Jennifer. Maybe he listens to me a little, but he really said he doesn't listen to either one of us. He said that your first name had to be spelled V-O-T-E-R. Okay? Everybody on this call, everyone on this forum has a representative. Every one of you has a state senator, and all of us have a governor. I am telling you, and I say this very respectfully, the way to honor Charlie's authenticity and guts, I mean, that's what it is, right? Guts. The way to honor her today is make 3 calls. Call your representative, call your state senator, and call the governor's office and say, do you know Kentucky has the 3rd highest rate of parental incarceration in this nation? What are you going to do, not someday, but what are you going to do come January? If you only leave here inspired and feeling warm, that's about you. So I'm telling you, you make those 3 calls to honor VOA and Jennifer, and most especially Charlie. And that's what I want to leave you with today. Take action. Don't just leave all warm and cuddly. Now, for the warm and cuddly, here's Jessie.
Thank you, Terry. Thank you, Jennifer. Thank you, Charlie, for just sharing your story and being really bold and courageous today. And just to piggyback off of what Terry said, we could not let you go today without reminding you to sign up for Children's Advocacy Week, which is coming up February 1st through 5th. So that's a great excuse to schedule some virtual meetings with your legislator and representative and say, what are you going to do about it? So we'll send you information about that in the follow-up email. We also want to thank Aetna Better Health of Kentucky for their support of these forums. And as Terry mentioned, we will be having more forums in 2021. They'll look a little bit different, but be on the lookout for a survey from us and some updates from us about what those forums will look like. And I just wanted to say happy holidays to all of you and happy new year to all of you. And we really look forward to seeing you in 2021.